Hello and welcome to Tête à Tête, France 24's flagship interview show. Our guest today is Basil Budair. He is a orthopedic surgeon, a member of Ideals, a British charity providing medical aid in conflict zones. He is just back from a mission at the Gaza European Hospital. It is located in Khan Yunis at the southern tip of the Gaza Strip. It's one of the last health facilities still operating in Gaza, and he joins us from Birmingham. Thank you very much, Dr. Budair, for being with us today.
Thank you for the invite. Thank you very much.
The World Health Organization has described the state of healthcare in Gaza as, quote unquote, being beyond words. You've been to Gaza before the war. You've now been to Gaza twice since it began. What would the words be for you to describe what's happening in Gaza?
Well, the situation is completely unimaginable. It's beyond anyone would have seen before. Personally, I haven't seen anything similar to that. And even in movies, I can't remember any movie that I've seen that actually mimics what's happening on the ground. And despite what all the news channels trying to convey and show people, well, what is it like on the ground, until you're actually there and live with the people and see the type of injuries, it's very difficult to comprehend.
Right. So this is your second mission to Gaza since the war. You went there first around Christmas time. You just came back from a 2-week mission. How does it work? You get in there, you've worked at the hospital. Do you stay at the hospital around the clock? How is that done?
Yeah, so we coordinate our visits with the WHO through the UN. We get our permits through that. We fly into Cairo and then across Sinai and through the Rafah crossing. We do spend the whole 2 weeks in the hospital. So in the first 2 weeks, in our first mission, which was over Christmas and New Year's, we stayed in one of the small nursing rooms in one of the field wards, which is basically a prefab ward that was put in place during COVID times, which now being used as a normal ward and place for IDPs. This time we stayed in a small nursing college in the hospital grounds. So yeah, we do spend the whole 2 weeks on site.
Right. Can you tell us what your days were like?
So our specialty as a charity in Ideals is limb reconstruction, and that's what we've been doing for many years, probably since 2009. So we usually a team of 4 in every mission. It usually comprises of 3 surgeons and an anaesthetist who also specializes in pain medicine. The aim of our mission is basically to support our colleagues on how best they see fit. So we usually, in the first day or 2, we do a ward round. We see all the patients that get referred by our colleagues on the ground and then formulate a plan on which patients we're going to be operating on. As I said, the main thing is limb salvage and limb reconstruction. And as you'd imagine, the majority, more than 80% of the injuries, at least the people who make it, are basically injuries of the upper and lower extremities. After that, we start planning our days, and every day we do anything between 2 and 5 surgeries. Most of these surgeries are complex, take about 4 or 5 hours to do. In addition to that, it's not uncommon for these surgeries to be interrupted by doing some emergency work. As you'd imagine, our colleagues there, they're very, very exhausted, they're very thin on the ground. A lot of them are dealing with other issues like their families being displaced, houses being destroyed, loss of life in the family or injury. So the level of staffing, whether it's doctors, nurses, radiographers, healthcare alliances, all that is very, very thin. And it's very impossible to cope with the sheer amount of trauma and injuries coming through the door. So a huge part of our work also involves operating on these acute cases.
Right. I imagine you've seen a lot of people come through the hospital. Are there some cases that really stuck with you? I mean, I guess there's an unusual amount of children, especially.
Yeah, I get asked that question a lot, especially after our first visit. And it's really difficult to know how to answer that because I'm sure myself and all my colleagues, we remember every single patient that we operated on because all these stories are basically sad and graphic is not only the sheer amount of injury that they suffer, usually multi-limb injuries. Some of them lose their sight, their ability to walk, but also a lot of them have been spent hours under the rubble in unimaginable conditions, and the psychological trauma that generates. Most of them also have lost most of their family members, lost their houses. So the trauma that they go through that is huge. Having come back again after 2 weeks, one of the main things that were on my mind is to check what happened to the patients that we operated the first time. Unfortunately, some of the patients we operated on couldn't make it. I'll give you an example of a 10-year-old child, Wasim Darfil, his name is. His house was targeted by a missile. He was in the middle area in Deir al-Balah. Both of his parents were killed, 2 of his siblings as well, and he was injured along with 2 of his siblings in Deir al-Balah. And at that time, the situation in the hospital there, Al-Aqsa Hospital, was dire. So after 2 days, they managed to transfer him to the European hospital. And when we saw him, we found that he had no blood supply. The blood to his left leg was completely cut off. His leg was dead, cold and white. In addition to that, he had multiple severe injuries to both of his upper extremities, facial burns. And it really touched me because he's more or less the same age of my son. And we tried our best. We did multiple operations on him to stabilize him. We had to amputate his badly affected limb. And he spent a few weeks in the intensive care. And when I came back and asked about him, I was told that he developed severe infection in his wounds, that his weak body could not tolerate it, and he died. Another one that also we asked about is a young lady by the name of Wafa Abu Anza. She is a leukemia patient. She had 4 kids. And only 7 months ago, before the war started, she managed to get bone marrow transplant. And she was looking optimistically to life ahead. Again, another missile injury hitting their house. She lost all of her kids except for 1. And she sustains very severe injury, facial injuries, limb injuries. And because of her leukemia, of her leukemia treatment, she was very weak. Her immune system could not cope with the number of operations she had to go through. And the main thing I remember, she telling us, please, I just want to live to be able to look after my daughter. Unfortunately, another one who developed infection, her weak body could not cope with that, and she passed away.
Right.
On the flip side, what keeps you going is the stories of people who are actually making it, people who never thought they would make it. And when we came back and we saw them back walking in better health, they look much healthier and in a better psychological status, and that's what keeps you going.
Right. What was lacking the most at the hospital?
What was, sorry?
Lacking. What was lacking? What did you miss in terms of medicines or infrastructure?
Yeah, you name it and they lack it. The key thing I would say is staff. They don't have staff. Our colleagues, the true heroes here, they've been working non-stop for weeks now with no respite. A lot of them actually during this visit where one of the anesthetists was on a drip, on an IV medication because he was very poorly. And he would sit down in the office for 2 hours receiving his treatment, have half an hour break after that, and then get up and start anesthetizing patients to have their operations. A lot of my colleagues would sleep in the equipment room in theaters on a very thin mattress, while the families in a corridor in a shelter, because their houses got demolished in north of Gaza. It's not uncommon for us to be operating and the nurse assisting me will start to become tearful. When I ask him about that, he said, well, my sister, her husband, 2 or 3 of her kids got killed this morning. My parents have nowhere to stay. They're just waiting outside in the hospital grounds, and I just want to finish the surgery and go and check on them. So, and every day you don't know who's going to be turning up to work because whether the security situation, they'll be trying to find food and shelter for the family. So I would say staffing is the key thing. And us showing another also NGOs showing up to support them is not only the aid we provide for patients, it's only the psychological and moral support for our colleagues is important. Apart from that, everything else is needed. Surgical equipment, medications, antibiotics, the kit they need for the labs to be able to do all the very key and necessary tests, whether it's a blood test, microbiology test, to the equipment in the intensive care unit, the anesthetic equipment, pain medications are all key things that they lack. But also simple stuff like beds or trolleys that you need to transfer patients. It's not uncommon for us to take patients out of theatres and just literally put them on the ground, on the floor in recovery, on either a blanket or a small mattress, just while they wait to be transferred to another ward, which is always often lacking, and they end up in a corridor or something. So you name it, they lack it, and the support they require is enormous. When we were there over Christmas and New Year's, Nasser Hospital was functioning, which is not anymore. So the sheer number of patients coming through A&E and that we're having to operate on is massive. And despite of all the work that we've been trying to do non-stop day and night operating, we left feeling that we've not done much, to be honest, because of the sheer numbers of injured people coming and the severity of their injuries. A lot of them would require more than 3, 4, even 10 operations to be able to save their limbs.
Dr. Basil Budair, that's all we have time for. Thank you very much for your testimony about your time in Gaza. And thank you all for watching this show here on France 24.
Thank you.